Hey, welcome back. It's time for our extra special. Now, despite a federal pledge to make Nigeria open defecation free by 2025, an estimated 48 million Nigerians still resort to fields, shorelines, and street corners, making the country the world's second worst offender after India. The Guardian's editorial board warns that without massive investment in household latrines and public sanitation, diseases such as cholera, dysentery, and stunting will keep exacting a deadly toll, especially on children and women. Government blueprints like the Clean Nigeria Use the Toilet campaign launched 2019 and the National Roadmap PEG, the bill for hitting the 2025 target at 959 billion naira, yet only a fraction has been mobilized. Bureaucratic bottlenecks and weak enforcement leave the streets awash, literally.
Now, enforcement, meanwhile, is highly visible, but uneven at best. Viral footage shot last week by content creator Seckley Marvin shows Lagos task force officers confronting an individual urinating beside Oshodi's busy bus bays, sparking arguments over dignity, fines, and the lack of public toilets. For health professionals like Dr. Olatunde Oshodi, every such scene is a reminder. Open defecation contaminates groundwater, drives up health care costs, and derails Nigeria's SDG 6 clean water and sanitation ambitions. So we're going to welcome our guests. We have joining us via video Seckley Marvin, content creator who actually captured the Oshodi enforcement incident, and Dr. Olatunde Oshodi, public health expert and CEO, Novate Health. You're welcome. I'm being told that we are awaiting Marvin to join the conversation, so we're going to kick off with Dr. Oshodi here. Doctor, you're welcome.
Doctor, thank you so much for coming on. We do have to talk about this toilet crisis that we see and the open defecation. Despite all the efforts by the government, it still persists with 48 million Nigerians nationwide still practicing open defecation. Which illness top your case files in this open defecation menace that we find ourselves in?
Yeah, you see, it's very unfortunate that this still goes on, in the 21st century, and a topic as, sounds as easy, to conquer as open defecation still persists in Nigeria. So for us, I'll say that the disease conditions that, top the list when it comes to open defecation is number one, diarrhea. Diarrhea, which is the leading cause of death in children under the age of 5 in Nigeria. And also, once, children, once they have diarrhea, then they are vulnerable, susceptible to other disease conditions like pneumonia, and other infections, that could come up once there is diarrhea that has weakened the immune system. So diarrhea is one major disease, that has kind of come to stay, in the system because we haven't tackled the issue of open defecation.
So, could you please give us details as to how this contamination affects us in an urban society, especially one where we have a total lack, many will argue, of facility for people? Could you speak to the failure in the system that we find ourselves, and how this is not just the perpetrator's fault, but how the government has also failed them?
Okay, so in an open society, in the urban society, I would say that majorly there is lack of education, right? And the lack of education, the lack of awareness, proper awareness for people to understand the impact of open is costing us a lot of issues. So for, number one, I believe that it is lack of education that is causing the prevalence of open defecation, in our society, especially in the urban society. People are not well educated. They do not even understand. It has become a norm, right? So we need to start things like social media campaign, to educate people. It doesn't even happen only with the underserved. It doesn't happen only with the uneducated. Even educated people, you know, when they feel pressed, they just want to go somewhere and look for somewhere, you know, maybe that is out of the reach of the eyes of the people, and then have this defecation done. You know, for guys, I think it's even easier. For men, they just look for somewhere and enclose themselves there and then do it. So I think number one is lack of proper education, right, in the urban system. We need to start educating the people. We need to start letting people know that open defecation affects each and every one of us, right? We hear there's a high rise of what we call poisoning, where people eat and then they have food poisoning because they have done open defecation, they haven't probably washed their hands well, or, you know, open defecation has been done and then they are eating foods that have been plucked from, you know, such areas, and then they end up being in the hospital. So I think proper education on how open defecation affects us as individuals, affects our children, you know, and how it can come to home. It's not something you just do outside and you leave it there. You understand that it affects you, it could affect your family members and, you know, one around you. I think proper education is one key thing that we haven't done. There should be a lot of awareness, social media awareness, public awareness on the impact of open defecation in our society. This will help. Comes to government, I think government has tried to do a lot of things because there was a state of emergency declared in 2018 as to open defecation, and this brought about, you know, the Clean Nigeria, initiative to stop open defecation by 2025. It's not working because I believe that we still need a lot of political will here, right? And the political will here doesn't have to come from the top. It's in the local governments, right, area, where local governments have to take responsibility for stopping open defecation. We need to take it to, you know, the local government level, the community level. Community will begin to raise task force to end open defecation in their community, knowing the impact of this. So even in these urban areas, we need to let it be, you know, the estates should know, the streets should know, the community to know, the landlords should be aware of why we are putting, you know, task force in place, we are putting enforcement in place to stop open defecation. When we begin to do this, we bring it home, not only at the national level, not only at the federal level, but at the local government level, right? I think this is what can help us in the urban areas, you know, to stop open defecation. Also, I'll also say that if I also say we need a lot of partnership with companies, you know, the private sector partnership, because
all right.
In some developed countries, can you hear me?
Yeah, loud and clear. We just for a second here, just to introduce our second guest, and that's Mr. Marvin. He's a content creator who captured a video that have now sparked this discussion that we're having here today. Let's roll that clip from his social media that captures a man who was being arrested under the Oshodi Bridge after urinating, or rather, taking a piss close to Oshodi on the bridge.
Now, once again, let's welcome Marvin Seckley. Marvin, you're welcome. Thank you very much for joining us this morning. Your video caught our attention, and that's what's sparking off this conversation. But Marvin, if you tell us exactly what the scene was, how this came about, how you were there in the first place, and what transpired after that the video didn't capture.
I was just out there making content. My camera was already rolling, and I see these guys in that banner accosting people who are taking a piss everywhere. And these two guys just came in my view while I was recording and started taking a piece, and the enforcers or whoever they are with the banners came, and that altercation ensued. So I was just there, camera rolling, and all of that happened.
Okay,
yeah, that is basically what happened.
We can also see that they seem to be wearing what's you call reflective jackets, and there's an inscription written on it. Can you confirm exactly what's written on that reflective jacket there?
It says anti-open defecation squad.
Okay, and what do you have to say?
That's what it says.
What do you have to say regarding the manner of enforcement here? Did it seem in any way, shape, or form, well, I don't know what word to use here, but what did you think about the mode of engagement when it comes to their enforcement?
It is typical out here that these things happen. This mode of enforcement is draconian, if I would say. I wish that the government can do it better. I would not support open defecation and what these people are doing. If this could be enforced better, it would make sense, because at the end of the day, these guys who with the reflective banners are just out there while they are while they are doing the right thing, stopping people not to do these things. It is an avenue to extort people, because they just drag these people to one corner office under the bridge and make you pay some money, and we don't even know where those money go to. So if the government can actually enforce this better, it would make better sense than just having random people with reflective jackets grab you while you take a piece. I mean, I can't support people who openly, mess up the streets and all of that, but there should be a better way to have this done. So, yeah.
I'm surprised they didn't come at you with your cameras and your equipment as you were capturing that moment. Was there any intimidation from them to you regarding filming that incident?
Yeah. Yes, at some point. My camera is a very small DJI camera, so for the longest time, nobody noticed that I was filming until the person who grabbed my camera was not even among the people who were, it was just some random agbero that grabbed my camera, and that was when the video cut, and I didn't continue filming, and another altercation ensued between me and them, and that's all. They didn't come at me, a random guy who thinks that if he grabs my camera.
If you say this was an agbero who grabbed your camera, are you saying that they were working together or not?
No, I don't think they are working together. Okay. I mean, we all know how Oshodi is. Oshodi has had the reputation of hostility for a very long time. So every random guy out there who has no job could just come at you, take your money. I mean, in the 90s, it was worse. Right now, it's, better that I can even film at all. So I don't think they are working together. But because the altercation has garnered a lot of crowd, and it seems like they know each other to some extent. So, and that was the filming. Grabbing my camera was not because, I was filming the altercation. It was just because maybe he thinks if he grabs my camera, they could get some money out of it.
Okay.
But I don't think they are working
Thanks for the
together.
clarification. Dr. Oshodi, let me come to you regarding enforcement now. You've heard how everything transpired there with Marvin's experience. Reflective jackets, grabbing people in the middle of their duty.
Operation.
Operation. How could you think this could be better enforced? Do we need signs? Do we need better communication? Do we need more awareness? Do we need more public toilets? How exactly can enforcement be civil at best?
Violence is not the way. It's never the way. It will never be the way, right? So I would say that, number one, for enforcement to be carried out, you need to first educate the people. Proper education, proper awareness. Now, this guy, that was altercated will probably be wondering what he's done wrong. Because he probably doesn't even know that there is, open defecation is wrong. He's probably grown up doing it all his life, seeing his parents doing it, seeing, people in his environment doing it. And there's no awareness to tell him that this is right, wrong or right? So before you can enforce a law, there should be proper awareness. And I don't think it's even supposed to be about bringing in some law enforcement, agents to be violent about it. Now we can erect a lot of sanitary, facilities across the state, across the urban region, where people can go in when they feel like they want to, take a pee. So, for example, we've done a lot of awareness. Then we can then put in this sanitary toilet facilities in place. Then people will know that, okay, there's now an awareness to say that if you're pressed, you can walk into any of these, facilities. You really do not have to pay, or you probably pay a token or whatever it is, to ease yourself really. But if there are no such facilities, tell me where these people will go, And even the facilities that we have that it was mandated for them to have toilets, some of them now, when people go in there, they're pressed and they want to ease themselves. And that's why I talk about private buying. Private companies must be able to buy into this. You walk into a police station, you ask for the toilet. Some of them say the toilet key is not available, the toilet is locked, and all of that. And you expect that these people will not practice defecation. There are certain things that cannot be stopped, like defecation, right? It cannot be stopped. It cannot only be held for a while. So people need to have that, confidence in the society to know that there is a place where they can safely go to take a pee before you can, enforce inadequate enforce, some law on as to them not defecating openly, right? So that's what I would say. It's not the way. Proper education, proper awareness. Social media is the #1 key, to awareness. Proper awareness should be done, and then you then provide proper sanitary facilities for people to use when they feel pressed in the public.
All right. And then there's also the Ministry of Waste Management as well, and also other agencies that are in charge of all of this. I'm just intrigued. I just can't wait to see, these officials go to the dump sites and grab people that are doing number 2s in there. I can't wait for such visuals. But Dr. Oshodi and Mr.
By the way, we must mention that we did invite the Ministry of Waste Management, but unfortunately they were unable to make it to this conversation.
Well, Dr. Oshodi, I must say thank you also to you, Mr. Marvin. Many thanks. We appreciate you for capturing that moment and just helping us, to bring this conversation back to the fore, to flash a bit of light on this critical discussion. Lady, gentlemen, thank you so much for joining us. We appreciate you.